You have to smile. Good afternoon, my name is Promise. Welcome to Smile360. Would you like to come through with me, please? Because you know what you're taking that patient, and I'm sure there must be protocols in here, so you invite that into it, but you just have to make it as quickly as possible. Smile, be verbal. The way you act and present yourself will reflect either positively or poorly on the practice as a whole. What does it mean to be professional? What do you think it means to be professional? It goes beyond the way you talk. It goes beyond the beautiful clothes, coming to work on time, punctuality. Absenteeism does not reflect well on any dental care professional, on any medical professional. Always dressing appropriately, neat clothes, flat shoes, hair tied back, taking your work seriously, having a good attitude at work adds to your professional demeanor. A dental nurse must not falsely suggest or imply that he or she possesses some special qualifications or skills, and must not use any title or description which will reasonably be calculated to suggest that you're a doctor when you're not. A dental nurse must not make comments of derogatory or disparaging nature on the services or treatment given out to patients, or a service that has been carried out by a dentist or by another dentist. Patients will come in and tell you that I went to my last dentist, I had this done, and while the dentist is away getting some stuff, you're chatting to the patient like, oh, it wasn't well done, it's wrong, it's very unprofessional, and it doesn't look right on the practice or on yourself as a professional. Dental nurses must not, under any circumstances, disclose information of a person of professional nature acquired in the course of work. It's also talking about confidentiality, which we spoke about earlier on. These are all ethics that guide the profession and should be your daily guide in the daily running, in your day-to-day running of the dental practice. Empathy is the ability to feel what another person is experiencing from their point of view. For nurses, it means putting themselves in their patient's shoes and trying to understand and they perceive what's going on around them. You will agree with me that a full day for a dental nurse is a whole lot of emotions. You'll meet patients who are happy, you'll meet patients who are really down, you meet patients who want to chat, you meet different sorts of people, and it tells on yourself as well. Sometimes it gets to you. You feel so bad, you feel so happy, but you'll be able to manage all these emotions together, because whatever emotions you portray, stability tells on every patient that you come across. Some patients will come into your clinic and realize that nurse is always smiling. They also come in and realize that nurse is always singing, or she's human. They listen to everything. So it just talks about how you manage yourself and make sure that you're so conscious of yourself, you're stable enough to be able to rub off positively on the next team member, on the next patient, and on everyone that you come across in the course of your daily activities. Research shows that emotionally stable nurses are better able to concentrate, solve problems, and keep their patients safe and calm. Like empathy, emotional stability is a skill that can be learned, but it takes time, and nurses need to be patient with themselves. We cannot stop talking about confidentiality. There are actually rules, there are actually bills, there are actually regulations that have to do with confidentiality. We have the Data Protection Act, which means that we cannot release any information that we come across about patients to any third party or to ourselves or to professional colleagues. In 1996, a Congress bill was passed designed to ensure the confidentiality and security of personal healthcare information. The Health Insurance Portability and Accountability Act, also known as HIPAA, which strictly governs who has the right to an individual's medical information and how it can be used. Today, medical information, dental records, may only be exchanged between healthcare providers when necessary and with consent in writing. For dental nurses, this means they can't discuss a patient's personal information with colleagues who are not involved in the case, and certainly not with family and friends. There isn't much difference between the dental nurse and the doctor except maybe knowledge. Yes, the behavior is basically the same. And we all heard everything she said. She is very experienced in art nursing and art teaching. So there's no fault in everything she
said. If you have questions, direct to her. Personally, have one-on-one. I'm sure her door is open, or speak to your dentist. So what I got was respect, yes, patient confidentiality, practice confidentiality. That's called intellectual intelligence. Yes, the property of the practice, what you learn in the practice, stays in the practice. Yes.
Respect your colleagues, very important. Respect for your work, very important. You respect your nursing. It's a career that people build, become something out of.